The intensive care unit, or ICU, is a critical care environment where patients often arrive in precarious health conditions. A smooth transition from the emergency room or operating room to the ICU is paramount for patient safety and well-being. Every second counts, and clear, concise communication between healthcare professionals is essential for optimal patient outcomes. Proper patient reception lays the groundwork for effective treatment and care. A structured approach to patient handover ensures that all vital information is relayed accurately and efficiently. This minimizes the risk of misunderstandings, prevents medical errors, and allows the receiving ICU team to provide timely and appropriate care. One such structured communication technique is ISBAR. In the high-stakes world of critical care, a standardized approach like ISBAR provides a common language for healthcare providers, reducing ambiguity and enhancing patient safety. It enables a concise and focused transfer of critical patient information, minimizing the risk of miscommunication and potential errors during the transition of care. ISBAR is an acronym that stands for Identification, Situation, Background, Assessment, and Recommendation. It provides a clear and concise framework for communication between healthcare providers during patient handovers, ensuring that all essential information is conveyed. Identification. This step involves clearly identifying the patient being discussed. This includes the patient's full name, date of birth, medical record number, and any other relevant identifying information. Accurate identification is crucial to prevent medical errors and ensure that the correct patient receives the appropriate care. Situation. The situation describes the patient's current status and the reason for the transfer. It includes the patient's primary diagnosis, current symptoms, and any recent changes in their condition. For instance, if a patient is being transferred due to respiratory distress, this should be clearly stated. Background. This section provides the receiving team with the patient's relevant medical history. This includes past medical conditions, previous surgeries, allergies, and current medications. Understanding the patient's background helps the ICU team anticipate potential complications and tailor their care accordingly. Assessment. The assessment involves a summary of the patient's current condition based on observations, vital signs, and recent test results. This provides the receiving team with a snapshot of the patient's status and helps them prioritize interventions. For example, if a patient has a dangerously low blood pressure, this should be highlighted. Recommendation. The final step involves clear recommendations for the receiving team. This may include specific tests, treatments, or monitoring that the patient requires. Clear recommendations ensure that the patient receives timely and appropriate care.
This is about John Doe, a 65-year-old male, medical record number 1234567. Mr. Doe is being transferred to the ICU due to acute respiratory distress. He presented to the ER with shortness of breath and chest pain that started about 2 hours ago. Mr. Doe has a history of hypertension and type 2 diabetes. He is allergic to penicillin. His current medications include metformin and lisinopril. Mr. Doe's current vital signs are blood pressure 100/60 millimeters of mercury, heart rate 120 beats per minute, respiratory rate 30 breaths per minute, and oxygen saturation 88% on room air. He is conscious but appears anxious. We recommend initiating oxygen therapy, obtaining a chest X-ray, and starting him on continuous cardiac monitoring. Please inform us if his condition deteriorates.
This structured communication using ISBAR ensures that the ICU team receives all critical information about Mr. Doe. They are now aware of his identity, the reason for transfer, his medical history, his current condition, and the recommended actions.
As a seasoned nurse, I cannot stress enough the importance of clear communication and teamwork in the ICU. Mastering the ISBAR technique is not merely about memorizing an acronym, it's about embracing a culture of safety and collaboration. When nurses effectively communicate patient information, they directly contribute to positive patient outcomes.
Mentorship plays a crucial role in nurturing this culture. I recently had the opportunity to guide a new nurse in our ICU. She was initially hesitant to use ISBAR, feeling it was too rigid. However, after observing its effectiveness in several patient handovers, she quickly saw its value. She began to confidently utilize the ISBAR framework, ensuring comprehensive and accurate communication with the team. This experience reinforced for me the power of mentorship and teamwork. By supporting each other and embracing standardized communication tools like ISBAR, we can create a healthcare environment where errors are minimized and patient care is optimized.
It's not just about individual expertise, it's about collective competence, where every member of the team plays a vital role in ensuring the best possible outcome.